got this. Dr. Fatunde, tell me, you mentioned one time a little bit about how a misaligned tooth or teeth, cause havoc in the body. The hinges here, which are some of the most complicated joint in the body because they go apparently 3 directions. They move this way, they move that way, and they can also flap like that, I guess. Either way, one can create major headaches and stuff when one has TMJ problems, when one has a misaligned mouth. It's not, crooked teeth are not the only way which make a TMJ problem, but it's definitely one way. Crooked teeth, missing teeth, stuff like that. In any case, tell us a little bit about how an orthodontist can help with headaches, neck pain, back pain, shoulder pain, because of a misaligned mouth.
Well, when we have misalignment of teeth, basically what happens is in function as we move the jaws, whether we're eating, we're drinking, moving the jaws forward and sideways, there isn't that full complement of movement of all the teeth because the tooth is not in its right position. When that happens, then the patient, especially over time, can develop what we call parafunction. The patient is trying to accommodate or adjust for the tooth that's not in alignment. So you get sometimes shifting of the jaws, sometimes you get the patient, trying to put pressure on other teeth. And sometimes you're going to wear of some teeth more than the other. So that any of those can lead to parafunction. As we have parafunction, then there is more stress on the jaw joint. And that's not the only one, but that could be the source of the TMJ problems. Part of parafunction is also that the patient biting, the patient, chewing down, and sometimes the patient is grinding because the patient is trying to find an accommodation. All of those could, in addition, also increase the tendency for TMJ problems. Sometimes it's the alignment of the jaw itself. There could be a shift in the jaw, and that by itself can lead to parafunction. So it's a number of factors that can actually affect the TMJ. So how does an orthodontist?
Yeah, go ahead. I just wanted to ask fast again one more time, 100% making sure in a layman's term, parafunction, what are we talking about? Just spend 5 seconds explaining it, please. Okay.
Parafunction simply means unusual function or unusual movement. So I talked about the patient trying to adjust. A tooth is not in alignment, it's growing on the inside or it's growing on the inside. Therefore, it's not making the right contact with the opposing tooth or even with the adjacent tooth. So when the patient is biting, because of that tooth being in a position that is not expected to be. So as the patient, let's say the patient is trying to move the jaw sideways, that tooth is not there, you'll find the patient adjusting, and as the patient adjusts, then the patient may be clenching, the patient may be grinding and putting stress on other teeth. So parafunction just means functioning in a way that's not expected to. Sometimes we call it dysfunction. All it's saying is there is a difference in the movement than otherwise will happen if that tooth was in alignment.
Got it. And you were to start saying how an orthodontist fixes that.
Okay. So a TMJ patient comes in. How can I help this patient? As an orthodontist, of course, I want to look at the jaw joints. I've taken X-rays that shows me the position of the components of the jaw joint. So, is the primary problem with the anatomical structure of the jaw? Sometimes it is. If it's not that, then I want to look at the teeth. How are the teeth? Do I have some teeth that are misaligned or not in the right proportion? That could be part of the problem. Is it the position of the jaws? Is the upper jaw way forward or, much further back than it's expected to be, or the lower jaw, is that what's causing the problem? Maybe so. Then I want to look at the function. When the patient moves the jaw from side to side, forward and backwards, how the teeth function. So, could it be because the patient has learned to adjust the bite, whether the teeth are aligned or not, that over time then the patient has developed stresses in the jaw joints? So you look at all of these and try to see why the patient could be having temporomandibular joint symptoms, or what we call TMJ. Sometimes it's not even any of that. Sometimes maybe the patient is experiencing some stress, and as part of the stress, now the patient is reflexly just grinding down or grinding, chewing, excessive biting of the teeth, in which case the patient now develops some parafunction because the patient is under stress. It could well be that. So we have a series of questions that we're going to go through with the patient. Did anything change recently? Is there any incipient stress that wasn't there before? How long has the patient had this? Has this always been a problem? And so depending on what the patient presents with determines what we do. And sometimes it's not a clear picture. We have to do it by elimination. So we'll go through the questions with the patient, and sometimes we have to sort of start with the bite appliance to see how the patient works with that, even when there is misalignment of teeth, because in some cases, until you actually get the patient to relieve the stress or the parafunctional habits such as grinding and clenching, you really cannot help the patient just by aligning the teeth.
So then maybe a person like a chiropractor or even a podiatrist straightening out the feet, or a physical therapist or a massage might have to be called in to help. Even sometimes maybe a surgeon, but at least in the lower end, sometimes those people, because maybe this thing was out alignment for a long time, and now it affects already the spine, or maybe it was the other way around. It got out of alignment because the spine was long time out of alignment, or it walked crooked. Is that a possibility?
That is a possibility. From the history from the patient, sometimes we can detect there might have been ongoing or chronic trauma due to misalignment. Oftentimes, some of these patients are seeing other healthcare professionals. And as I said earlier, in dealing with an adult, you want to get in touch with all the other healthcare professionals, because they can provide some of the answers. And even if it's not the answers, if they don't have the answers, we all can come to the same page and understand what are the symptoms that we see with this patient. And I can say, you know what, I noticed this, and I noticed this, and I noticed this. And another healthcare professional can shed some light to say, I've been treating this patient for so and so for the last so many years, or this patient came to me with a history of this and this, and all of that put together oftentimes will help to provide the answer to the problems of the patient. Right.
Well, the body, like everything in life, is such a huge synergy, and frankly, I don't think in any field, from business to health to whatever it might be, we really do not completely understand it. And I think one of the things in terms of bodily health, for instance, if a person comes to you, maybe you eliminate the fact that no, it's not your jaw, it's not your teeth, you're having a headache for a different reason. The chiropractor might eliminate it, and the podiatrist may say, yeah, your foot is 1 inch shorter than the other one, and you're getting all wrapped up already. I mean, probably if that would happen, the chiropractor would know that already also. But the point is, it's really finding the cause for something, or finding a new solution, or inventing something has a lot to do with elimination. So, one person eliminates that and one that. But let me ask you this. If a person has had headaches, shoulder pain off and on, and has tried a few things, maybe gone to a chiropractor, maybe helped, maybe came back, obviously probably took a truckload of aspirin and that type of stuff, which most likely doesn't do nothing. Bodies are not born with an aspirin deficiency. Would it be a wise thing for him to go to a dentist, to an orthodontist who knows how to look at the bite and A, fixes it or eliminates it as the cause? Would it be a wise thing to do for a person who has this problem and it doesn't seem to get away?
I believe that it will not hurt. The orthodontist can at least look at the bite and be able to say, you know what, your bite is fine. Or I notice that this teeth needs to be in this position, or your jaw needs to be in this position, and we need to address that. Now, is that necessarily the cause of the pain? That's another factor that we need to look into, that the fact that the bite is misaligned or that the jaws are not in alignment, is that what is causing the headache? Definitely we must talk to the physician who's been managing the headache. A number of people experience migraines. It may have nothing to do with the alignment of their teeth. Would aligning the teeth necessarily help? Maybe in some cases, if part of the problem has to do with the jaw. And in other cases, maybe not. It is by touching base with other health professionals that we can actually narrow down, put together what seems to be the symptoms, and narrow down the best way to be able to help that particular patient.
I can really see that patients in your office are in good hands because, you know other professionals are needed, other areas influence every area, and I can see that you're not a lady who promises the sky just simply because it's there. And I'm sure your patients really, really appreciate that. And most of the treatment for DMJ, basically headaches and stuff, most of it, maybe not all, is really not very invasive. It's an aligner. It's like saying we're not talking heavy major metal surgery things. It's usually a relatively easygoing treatment. Is that correct?
Not always. It all depends on what the underlying factors are. Sometimes there are major, treatments that are needed. Some people do need to have joint surgery. Sometimes, the surgeon needs to inject into the joint space and try and quieten the inflammation that might be there. Everything depends on that particular patient and what the patient presents with, and what findings we're able to put together in the investigation. And again, the best way to help the patient is interaction and consultation with other professionals that may be managing the patient.
Wonderful. And if a patient with such a problem arrives in your practice, you will do your part of investigation, as you so gently call it, and then make sure that the coordination of other healthcare professionals gets involved in order to get the results. So your office, no matter what, one way or the other way, is a good starting point. And if he goes to the right chiropractor, that person might also think the same way you, and it will be a good starting point also. But for now, here we are. A patient should know and be aware that a dentist / orthodontist could and should probably be involved in it, especially if it hasn't disappeared. If you have a headache and you go to a chiropractor and it disappears, well, no reason to do much more, right? It's gone. You're done. But if it doesn't, that's what we're talking about, correct?
That's correct.
Thank you very much.